Aron King is a registered nurse and an assistant manager on the medical telemetry floor at UC Davis Health. He is also the secretary for the Capital City Black Nurses Association in Sacramento County. He is currently working on his Master's of Science at UC Davis. As a nurse leader, his goal is to increase diversity in the nursing workforce through outreach, particularly in Hispanic and African American communities. He will be presenting his thesis work on microaggressions. It is my pleasure to welcome my colleague and friend, Aron King.
Thank you so much for the introduction. I'd like to start by just thanking all the organizers, especially the student organizers of this conference. It's such an honor to be asked to speak among such a highly decorated and highly educated group of professionals. So we'll go ahead and start. You could, next slide, please. So what is a microaggression? I think we should start there before kind of digging in and making the connections between inequalities and health disparities. But microaggressions are subtle, intentional, or non-intentional messages sent through body language, word choice, and or behaviors that have the effect of insulting, degrading a person based on race, gender, sexual orientation, or heritage. The concept was first introduced in literature by Dr. Chester Pierce. He's the gentleman that's pictured here above. His research at the time really only focused on the African-American community and their interactions with non-Latino white individuals in the community. The research on microaggressions was later expanded upon by Dr. Daryl Wing Su, who actually grew to become one of the most prolific scholars on microaggressions. He's pictured below. In addition to expanding the definition to include other demographic groups such as the Latinx, Hispanic, Native American, and Asian populations, he also identified 3 categories of microaggressions. So the 3 categories are micro assaults, micro insults, and micro invalidations. A second thing was also identifying his research was themes, and I'll touch on that a little bit later. Next slide, please. So the different categories of microaggressions. So let's keep in mind that microaggressions are both verbal, or can be both verbal or nonverbal, and they can also be intentional and non-intentional. So microassault is the first term that we'll address here, is defined as a type of old-fashioned discrimination. These are intentional verbal or nonverbal attacks that are intended to offend the recipient. So the example that I have here on the right is the Confederate flag, which historically has ties to the South, particularly to slavery, but is also frequently flown by white supremacist groups. So one can argue that they fly them because of the heritage, that their connection in the South, but others, as a minority, a lot of people see them as very offensive because of their connections to slavery. A microassault is the next term I'll talk on, and it's defined as subtle, non-verbal or verbal snubs, often unknown to the predator. They're often unknown. They convey a hidden insult that demeans a person's racial heritage or identity. I like to refer them as kind of like backhand compliments. Those are kind of like backhand compliment most know, or kind of like, wow, you look really skinny today, or something along that. But the example I refer to here is, and you'll see actor and comedian Chris Rock. He famously criticized the media in one of his stand-up comedies about comments that were made towards U.S. National Security Advisor Colin Powell. And I believe it was when he was running for president. A lot of people in the media referred to him as being very articulate, which is pretty offensive. It kind of begs you to ask the question, what would you expect from someone who is educated? Why exactly is this surprising that he's articulate, and why is that something you would highlight? I would also like to point out that these comments, such as being very articulate and clean, were also made towards former President Barack Obama. A micro invalidation is an ambiguous statement that denies or undermines a person's thoughts, feelings, or experiences as a member of a minority group. So I have 2 examples for that. one example that I'm seeing a lot, like on social media, is color blindness. And what those are statements such as, I don't see color, or we are all one race, one human race. And what that does is basically it negates the experience of minorities, and you're pretty much denying that race plays a role in how people navigate life, which we can all agree that race does play a role in how people live and how they're seen by others. Another one was the creation of All Lives Matter, which I have here also on my slide. And it was kind of created as a response to the affirmation Black Lives Matter, right? And so that really undermines the movement while also failing to acknowledge the unjust police brutality that is experienced by African Americans and other people of color. I know I did mention some themes earlier, and I'll give a couple examples. There's 8 themes that existed that been identified by Dr. Darrell Su. So alien in one's own land. And that's kind of like an example would be a comment such as, wow, you speak English very well, made towards maybe a Hispanic or Asian American individual who is also born in this country. So it's they're seen as other, which is very offensive. And then the next example I used here is criminality or assumption of criminal status, which I've experienced personally. And it has to do, a good example would be entering a room and noticing maybe someone like grab their purse and kind of pull it towards them. Another example that I've experienced, I worked in hospitality, and there was a professional conference there. And one of the guests had made a comment about her roommate who she just met in the conference, sleeping with all her jewelry on. And so that kind of sent the message that the roommate thought she would steal from her, you know. So we'll go ahead and go to the next slide here. So what is the impact, right? So what is the impact of microaggressions? While all the literature that I've studied and that's out there will tell you that a single experience of a microaggression isn't really sufficient enough to extensively disrupt the well-being of a minority or a minority individual. It's actually the repeated bombardment that really makes the impact. So this first study that I cite here is a study that was performed at Princeton University, which examined the cognitive reaction of non-Latino white students and Black students to prejudice. So they actually found in the study that non-Latino white participants experienced the greatest cognitive impairment to blatant racism or prejudice, while Black participants experienced the greatest impairment to ambiguous forms of prejudice, which is, as I just explained, a microaggression. The second study here that I cited basically explored hope as a mechanism to mitigate microaggressions. So they accomplished this by examining depression symptoms in participants. So the study was pretty important because it showed that participants with moderate to high hope actually reported more depression symptoms associated with microaggressions than those with low levels, right? And so if you think about those with the highest hope and the high achievers, those are the individuals that are in college, right? Undergraduate, graduate, PhD, and they have an extra sensitivity to these microaggressions, or at least will display more depression symptoms. The final study that I listed here examining depression symptoms caused by racial microaggressions and whether they predicted suicide ideation in minority participants. And it was found that, in fact, there was a positive correlation that existed between microaggression and suicide ideation, which is crazy because that's pretty much suicide, right? So kind of taking into account like microaggressions and how they impact mental health, you could see that they can ultimately be very detrimental to the success of this population of students. So we'll go to the next slide, please. So microaggressions, let's see. So why should we care? We'll start right there. Why should we care, right? That's my title. So microaggressions really weigh on the success of students. but particularly let's talk about those students in the medical profession, right? Those students that are in med school, whether you're in nursing school, NP, PA, right? So the National Academy of Medicine, which was formerly known as the National Institute of Medicine, has recognized bias, stereotyping, and prejudice as contributing factors to health disparities and suggests diversifying the health profession workforce as one strategy to mediate these issues. So I want to start by first apologizing because I woke up this morning and I decided to add a little bit of data and it's not on my slideshow. So I'll go ahead and read it off to you. So according to a 2018 national survey of registered nurses, racial minorities only make up 24.9% of the nursing workforce. So that's important because nursing is actually the largest workforce. So it shows you that between all the minority groups, we only make up a quarter of the workforce. I'm sure many of you are familiar with a lot of research that's out there that shows that minority groups have poor treatment in healthcare. Examples would be less likely to be treated aggressively and receive interventions for MI, less likely to be admitted for the same disease process as a non-Latino white, and even be treated for pain. Sometimes these come as intentional and sometimes they're intentional or unconscious. So unconscious bias or implicit bias is pretty well studied in literature. The study I refer to here in the slide was actually done by Dr. Tiffany Johnson. She's a pediatric emergency room physician right here at UC Davis Health. And I wanted to add a note before I actually talked a little bit about her study. This study was done prior to her arriving at the university. So I don't want you to think this data reflects UC Davis, and I don't want to try to get in trouble for it. So her study found that many healthcare providers hold an unconscious pro-white, anti-Black racial bias, which really is a strong indication that we should really increase diversity, right? The next term that I referred here is racial concordance. That actually refers to providers and patients sharing a similar racial identity and has been associated with better interpersonal relationships, particularly among minority individuals and their providers. The study that I refer to here involved HIV patients and found that participants that were more likely to use preventative care and less likely to delay treatment when under the care of a provider that shared a same race. Another example I could use is just, in life, if you need to see anyone for mental health, say you're African-American female or white female, you may feel more comfortable talking to someone at least of the same gender. So it's very similar here. And it's not just, I don't think it's just, it's particularly could just be to racial minorities, but also gender minorities or any kind of group, right? So we'll go to my next slide here. So the call to action. So like, what can you do to help this group of students, right? These students that are out there, right? So most of my information I had in the presentation focused on racial microaggressions, but there are other groups that are impacted. So there's the LGBTQ, there's those with disabilities. Those are all examples of other groups that could be impacted or affected by microaggressions. So I know a lot, like with professional organizations and companies, they talk about a lot of cultural competency training. So that's like you take a class, maybe a 6-hour, 8-hour class, or maybe it's just like a click couple slides class and take a quiz. And somehow you get a certificate and you're ready to go in the world and care for this diverse community of people. And you pick up little pearls of wisdom, maybe not to refer to Asians as Orientals, or, not all Hispanics are Mexicans, or Native Americans are not Indians, those kind of things. And feel free to type those in the chat, because those are actually kind of funny little things that you're taught there, which is weird. But I think really the focus should be on cultural humility. So I'm not sure if you may know, but Dr. Jan Marie Garcia, who's a professor at Betty Irene Moore School of Nursing, she actually coined this term, and I think it's more of a suitable goal moving forward, right? So what it is like a lifelong commitment to self-evaluation, self-critique, and understanding. So you're pretty much going in knowing that you don't know everything, but you're welcome to learn, right? My second bullet point here is keep the tax. And so what do I mean by that? So some may know of a term, minority tax. So the term refers to like the added responsibility of minorities, whether they're students or coworkers, to be the ambassador for their minority group, to be the teacher, to speak for their whole community. And this really, really adds an extra burden onto these minorities that are working or in school, these learners. And so what could you do instead, right? So a lot of kids, they say, do your Googles, right? So get online. I mean, there's lots of resources. There's books, there's documentaries, podcasts, YouTube, videos. There's conferences like this one, right? Where you could go and get more information, and you could actually build yourself as a better ally. And then I have listed here calling out versus calling in. I'm sure all of you guys understand what calling out means. We all have social media accounts, and we'll talk about, oh, I really called him out and I told him, that's offensive or whatever. But what does it really mean to call someone out? So calling someone out is really focused on preventing further damage. So stopping the person in their tracks and letting them know that this behavior is not tolerated. That is one option. The second option, which I've just frequently learned, like just recently learned about, or at least got a definition for, is calling in. And so what that is it's creating an opportunity for education. It's pulling that person aside or sliding into the DMs, like the young people say, and really having a conversation to let them know how their actions or words really impact others and what they can do better. Next slide here. So this next slide is just some of my references. Obviously, I didn't reference the data that I collected regarding nursing, but I'll be more than happy to share that. And then next slide. So thank you. I just want to send a huge thank you to everyone involved in organizing this conference, my wife and my kids for being very patient with me. My thesis chair, which is Dr. Piri Ackerman-Barger, and my committee, which is Dr. Fawn Cothran and Dr. Jan Marie Garcia, and then a huge plug for Capital City Black Nurses for building me as a better leader. And I am now open for questions. You can hit the next slide.
Awesome. We'll just have a round of applause for Aron.